All right, now we're going to start, and we're going to start with defining terms and pronunciations. You are one, Laurinda Kwan. You are a doctor of...
Naturopathic medicine.
Okay. Would I be considered a total illiterate if I called it naturopathic?
No. It's used interchangeably.
Okay, all right. So then the next time I have somebody on and he corrects me, I'll say, will you see Dr. Kwan, please, if you will? Would you, now having defined the pronunciation, would you define the practice?
Sure.
What's the difference? Well, in fact, you are a naturopath and you also practice homeopathic medicine.
Yes, I do.
Okay, what's the difference?
The difference is naturopathic medicine sort of is the umbrella term of our profession. So within that, we learned natural therapies, one being homeopathy, along with clinical nutrition, acupuncture, botanical medicine, to name a few of them.
Do I have to get all of those if I come into your office with a cold?
No, you do not. Homeopathy is its own distinct medicine. And so it is, like I mentioned, one of the therapies that we learned in naturopathic school. However, with homeopathy, what it does is it helps to stimulate your body's own natural healing mechanisms.
How do they do that?
How does it do that? Well, it's based on the law of similars. So what that means is that what a substance can cause in a healthy person, it can cure in a sick person.
Is that the fundamental philosophy behind the use of vaccines?
It's sometimes we use the analogy, it's not exactly the same. It's not like an inoculation. It's always about supporting the body's own healing ability. So for example, describe to me what would happen if you were to cut a raw onion.
I would cry.
Sure, exactly. Your eyes would maybe start to burn and get red. You know, your nose may start to run a little bit. Well, in a medicine that is derived from raw onion and it's homeopathically prepared, what it does is in a sick person, it cures those symptoms. So maybe in somebody that has a cold or allergies that have similar symptoms.
How long has that been around, though? I always like to ask because Asian healing has been around for so long, and Western medicine has been around for such a short period of time, but it's the Western medicine practitioners who are the smug ones. It just always seems that the MDs and the people of the West tend to say, well, that's primitive stuff, you know, and going and using those plants and those animal byproducts, for crying out loud. We haven't approved of that yet. But it's worked in Asia for thousands of years.
It has, and homeopathy has been around for over 200 years and been practiced very successfully.
What about naturopathy?
Naturopathy has been around again for several hundred years. It's seeing a resurgence now.
You can understand why people who are afraid of going to the traditional doctor, the MDs, and they don't look forward usually to a date with a doctor. But when they are thinking about possibly trying the concepts that you're talking about, that they don't know anything about at all, don't you find that they really get nervous coming into your office if they've never tried it?
No, not at all.
Really? Why?
Really. In fact, I would say the majority of our patients really enjoy coming in to see us.
The first time?
Sure they do. They absolutely do. I think it's not uncommon that we hear patients after our first visit say, my goodness, I have never ever had a doctor ask me those questions before.
Like what?
Like, we're always talking about who they are as a whole person. It's not just about the disease symptoms, it's about who they are as a whole person.
Listen, I know a lot of people who would be stunned that their doctor actually talks to them in the office or takes the time to do that. Tell me what you brought here.
Okay, so this is a nice little homeopathic home remedy chest is what it's called. And these are some of the common medicines that are generally used for acute things, minor things that you can treat at home. And because homeopathic medicines are very safe, they're safe to practice at home. So, for example, they're really good for minor cuts and bruises, for the odd headache or sniffle. Obviously, if it's something more serious, you want to see your healthcare practitioner. But
I can actually take care of myself at home. That is never recommended by my doctor, by the way. You know that.
we always encourage empowering our patients.
Okay, all right. Now, this is Ignatia Amara.
Yes.
For grief and emotional upset. It says right there.
Yes, it does.
So you can deal with anxieties and things like grieving?
Absolutely.
What is that? What's in here, though? It's called Ignatia Amara.
It's derived. A lot of the naturopathic medicines are from some sort of natural source, so either plant, animal, or mineral.
So I just
That's
pop
from
a couple of these if I'm really feeling down?
Sure, if the symptoms match the medicine. So if you have grief, you have some sort of emotional upset, yes, this would be a really good one for you to take.
What do MDs do differently than naturopaths and homeopaths?
Well...
How do they treat me for, all right, you mentioned a headache, all right?
Sure.
My wife consistently gets headaches when there is a change in the atmosphere, when there's a weather change, and I don't know what that is, but it seems to affect a lot of people, including her.
Okay.
So you get a headache, whether it's from that or any other cause. What would an MD do that you don't do, and vice versa?
Okay, well, generally, an MD probably, for the most part, only asks her about her headache symptoms and probably will prescribe some sort of headache medicine.
Yes.
Whether it's Excedrin or Tylenol, etc. We're never just about the headache. We're always about the whole person, because the more we understand the person and their pattern of symptoms, the better able we are to match the medicine to the person, and the better able we are to get the person better as a whole.
If I caused you to be distracted and then immediately took this home, right, thieving little rascal that I am, and I found that one of these said for headache, without seeing you, could my wife take this and get relief?
If the medicine matches her symptoms of a headache, because everybody's headache is different. That's what's different. A doctor, you go see a conventional doctor and you say headache, they don't necessarily care how your experience of the headache is, but we do.
So
we
maybe
care.
stress and tension would cause one headache, and the meteorological happenstance of the time might cause another, and those are treated differently with homeopathy and naturopathy?
They're likely treated with a different medicine.
Mm-hmm. What about the claims that are made by people outside the field of traditional medicine, Western medicine, if you will? And those always kind of bother me, no matter who's making the claims. But it's, if you take this root, you will cure cancer. And if you have the algae of the month, you see them a lot on health food stores, some health food stores. How do we pick the non-traditional medical practitioner to know that this is a responsible person?
I think the best way to do that is to talk to and to interview the practitioner. And also it's important, particularly with naturopathic medicine, and at least in this state, we are licensed, and so it's important that you see a licensed naturopathic doctor.
What has your education been to be a doctor of naturopathy?
4 years of medical school, attending an accredited naturopathic medical school, and then after that we have to pass licensing boards in order to practice medicine.
You have to be kind of careful sometimes if people are making claims. They just hang a shingle out because they may not know what they're doing at all, and people are taken advantage of sometimes.
That's why it's important to see a licensed practitioner.
And you
because we
said
have the
interview.
training.
I can't even imagine my doctor taking the time to have me ask him questions, but maybe I've been going to the wrong doctor.
Maybe.
Dr. Kwan, you're practicing where?
At 1250 East Baseline Road, on Baseline, between Rural and McClintock.
And the rest of the
Tempe.
information is on the picture right there. And Dr. Laurinda Kwan, fascinating field, and it has been going on for a long, long time. Naturopathy and homeopathy. I wonder if they would help the Cardinals next week win a game. You know what? There may be a naturopath on the medical staff of the Cardinals. I don't know, but I'll be asking a sports figure coming up next. Not a player, a broadcaster.